So Crossover is a Christian ministry that provides a health home to over 6,000 people in the Richmond region. And our patients fall into two groups. They are uninsured, low-income patients or folks who are enrolled in Medicaid. And as a health home, we provide integrative, comprehensive health care. So we provide primary care, pediatrics, dental work, ophthalmology services, mental health counseling, subspecialties, HIV testing, prenatal care, and we have a licensed pharmacy on site. And we're able to provide the care that we do with the help of over 300 volunteers every year. So we partner with our volunteers to provide the high quality, affordable care.
Crossover not only is able to provide health care for families in need in the Richmond area, but we're able to wrap our arms around those families and support not just the individual patient, but families as a whole.
So I think partnership is when you have two groups and they really understand one another and what is fulfilling and the goals of the other party. So at Crossover, we really work in partnership with volunteer individuals or also community groups or churches, and we really work to understand what type of experience are our volunteers or our other partners trying to get with Crossover. Because through our volunteers, we're able to serve an amazing number of people that we could not serve or provide services that we could not provide without the help of our partners and our volunteers. And then we hear from our partners and our volunteers that the experiences and the interactions and the service opportunities at Crossover are really fulfilling to them as individuals, as groups, and the acts of faith that they're able to do through Crossover is just really fulfilling for the ministry in their lives.
Partnership is the basis of what we're able to do here at Crossover. We cannot help our families on our own. We require our community partnerships in order to provide medical care and our social work services as well. Social work has been very fortunate during the pandemic to work with our community partners in order to support families who didn't have food, didn't have money to pay rent, didn't understand how to pivot with changes in the public school system. And so it was from support from our partners that we were all able to work together to help struggling families. So during the pandemic, I met with a mom who had arrived in Richmond after fleeing a domestic violence situation in her home country. Mom was here with 4 children. She had lost her job and did not have money to pay rent. Her oldest child was enrolled in public schools but did not have a computer device nor internet access at home in order to attend school virtually. Social work was able to come alongside mom, find resources for food, get her rent paid, as well as get her son that access to school that he needed, internet in the home and his laptop device to attend school virtually. Then when school pivoted again in the fall for school to remain virtual, we were able to help mom get those other 3 students enrolled and get their devices and attend school virtually.
I think about the impact before COVID. You know, certainly COVID has had a huge impact in our community. But one case that really comes to mind for me was a gentleman whose name was Brian, and he was moving to Richmond from out of state, and he actually had a job lined up in Richmond. He was moving his family here to take a job as a security officer, and he was all set to come, and he had one last hurdle, and that was the pre-employment physical exam. And he went to kind of an urgent care facility in his home state, and he failed the pre-employment physical because he had a really high blood pressure. And of course, he didn't have a primary care physician. He was going to have health insurance after he started his new job in Richmond, but at that point in time, he did not have a job, and he did not have health insurance. So it was that old conundrum of, gosh, I'm going to have health insurance as soon as I get a job, but I can't get a job until I have health insurance because I need treatment in order to qualify for the job. So he was referred to Crossover, and we took him on as a patient. We were able to give him high blood pressure medicine so that he could get his hypertension under control, and that allowed him to pass his pre-employment physical. And we do know that he did get the job here in Richmond. He moved his family here, and he and his family were doing really well. And so the care that he received at Crossover was fairly short term, because after he got his health insurance, he graduated from Crossover because he had benefits through his job. But without the intervention here at Crossover, he wouldn't have been able to do that.
With the Connection Center, this is where phone calls go to if somebody wants to make an appointment. This is the first thing that happens when somebody becomes a patient, is that they call in to make an appointment, and this is where all those phone calls go. So there is a dot on every single country where we have patients from.
Oh, wow.
So I think this really shows one aspect of the impact that we have, and you can see that it's all across the world.
Yes.
It's pretty amazing that we're able to serve so many different patients from all over the world, and also shows that we need a lot of different types of people on our team in order to reach the patients that we're reaching. This is our nurses station. Right now we're in between the morning shift and the afternoon shift, so it's not busy, but in the morning and the afternoons it is super busy through here. This is like the main hub of a medical clinic, and you'll see nurses here and other clinicians.
So you can see, if you look at this board, this is really interesting. So like volunteer, volunteer, employee, employee, but like volunteer, volunteer, employee, volunteer. I mean, that's just, how integrated we are in terms of volunteers.
Volunteer.
Volunteer, yeah.
And our interpreters are volunteers as well. Interpreters are a huge need, as well as nursing and nursing support. So that really impacts the number of volunteer clinicians that we're able to have, because they are all going to need nursing support to work with their patients. And the more nurses we have, the more clinicians we have, which means the more patients we can see. So
And we even have it so that people can interpret over the phone. So if there's someone that's interested in interpreting and they don't have transportation, or they're uncomfortable coming in a healthcare setting, considering COVID, they can still volunteer using the phone.
We have a pharmacy at our Richmond clinic, and they are able to dispense medications to 6 other medical safety net providers in the area, as well as this clinic location. And so a lot of the medications that you see here, patients that come here regularly are able to pick them up, but they're not able to be fulfilled here. So our vision clinic sees about 1,100 appointments every year, and they're able to see both crossover patients as well as patients from the 6 other safety net providers in the area.
I've been volunteering in the eye clinic at Crossover Clinic since November of 2015. I'd spent most of my career working with the Virginia Department for the Blind and Vision Impaired, so I had a little bit of a background regarding vision and that sort of thing. And Crossover, the eye clinic, just provides an invaluable service. It's amazing to see how many people come through here in their 40s, 50s, 60s, and they've never had an eye exam before. This is their very first eye exam. It's pretty remarkable. And a lot of people walk out of here with the ability to see much better, which certainly improves their daily lives, gives them better opportunities as far as working is concerned. So it's a very, very good place to work or volunteer.
And our dental team sees 3,400 appointments every year. They really strive to make patients feel as comfortable as possible, just because I think in general people are very nervous seeing the dentist, but especially if it's your first time ever seeing a dentist, they really try to make their patients feel as comfortable as possible.